Hi everybody, it's Dr. Ansari. We're going to be talking about other therapies, conservative therapies that can be initiated after the first set of initial therapies is tried. There may be circumstances where your physician can do both what I talked about in the last video with initial treatments and these medical treatments at the same time. And it really just depends on how severe you are when you come to the office. So first, one of the things that might be tried are medications to help reduce the frequency and urgency that are pill form, okay? So these are called anticholinergic, or there's another called mirabegron, and these are used to decrease the urgency and frequency of urination. If you're having a lot of pain, then your doctor might prescribe other pill medications, such as gabapentin or nortriptyline. I think I spelled that right. So nortriptyline. These target the nerves that cause the pain. Okay, so the first set of medications right here is to tackle this, the urgency and frequency, and the second set is to tackle the nerves. Another therapy may be bladder installations. So this is putting in a special anti-inflammatory cocktail of medication directly into the bladder to try to knock out the inflammation and again the pain and urgency and frequency issues that you're feeling. This is often done in a series where you do maybe 4 or 6 in a row, like usually once a week, to try to tackle that inflammation. Another thing that your doctor may want to talk to you about is pelvic floor physical therapy. And these are super specialized physical therapists who work with people who have issues with the pelvis or pelvic organs. And they work with you to try to teach you how to relax your pelvic muscles. Because essentially if your muscles are hyperactivated, they're too tight, okay, then that can trigger increased nerve irritation, okay? And then the nerve irritation then causes more irritation to the organs, like the bladder. Okay? Not gonna fit. So, if we tackle this, it'll, in an indirect way, help decrease the symptoms of urgency, frequency, help calm the nerves down, and in a way also indirectly decrease the inflammation by decreasing the irritation. Another really important treatment is cognitive behavioral therapy. And this is done by specialized psychotherapists, and they basically help you with your coping mechanisms with pain. And that ultimately helps target this part, the stress, so that it decreases the amount of inflammation that it provokes or causes. So if you have a lot of anxiety or depression or have been diagnosed with anxiety, depression, this is going to be a very important part of the therapy to try to decrease the stress and anxiety that further contributes to the inflammation that your body feels. Research shows again and again the link between anxiety, depression, and increased pain sensation in the body. So it's really important to make sure that the anxiety and depression that you may have is properly controlled through medication and cognitive behavioral therapy. In the next set of videos, actually one more video, we're going to talk about procedures that are done for pain and interstitial cystitis treatments.